Why?
Hello and welcome to What Can I Do with a Nursing Major? My name is Lydia Ricard and I'm a career assistant with the Career Resource Center. And this panel is put on, it's sponsored both by the Career Resource Center and the Nursing Club. Thank you guys. And for this panel, we'll go from 7 to 8 o'clock. And the way it'll work is our panelists will take a few minutes to introduce themselves and tell us about how they got where they've gotten today and all of that good stuff. And then they'll open it up for questions once we've gone down the line. So here we are.
Great. Well, good evening, everybody. My name is Alice DeLane, and I am a 1998 graduate of the nursing program. Prior to that, I was an LPN since 1984, so I did come into the area with a little bit of nursing background. My first job as an RN was at the St. Cloud Hospital. I worked there for 11 years, and I served on the medical oncology unit there as a staff nurse. From there, I started full-time and then stayed casual at the St. Cloud Hospital because within a year later, I had the opportunity to go over to surgery, and that was outpatient surgery, ambulatory surgery at the St. Cloud Surgical Center. I worked there for about 10 years as an OR circulator and also then as an OR charge nurse. And during that time, back in 2001, I was a member of the Army National Guard, like I said, and served as a medic. But then I transferred over to the Air National Guard and received a direct commission and became a flight nurse. So I certified in flight nursing and then served from 2001 to 2005 doing air evac missions over in Baghdad and Kuwait. So then after that, I retired from the military, and then from there, I went over to the St. Cloud VA back in 2009, and currently work there now as the clinical nurse leader in outpatient specialty clinical services and ambulatory surgery. Within that time, back in 2011, it was about a year ago, I certified in the OR as a certified nurse. And then also, back in 2010, I began taking courses towards my master's degree in, again, clinical nurse leadership. And that's kind of where I'm at this point, finishing up with my master's and working at the VA. Thank you.
Well, good evening, everyone. My name is Deb Stueve, and I am an 89 graduate from the College of St. Benedict. Like Alice, I brought nursing with me. I am originally a 1977 grad from the St. Cloud Hospital School of Nursing. So I had worked in medical and oncology, labor and delivery, and then moved out to the VA and worked there as a psychiatric mental health nurse. It was while I was at the VA that I decided I needed to go back for my bachelor's degree and did that here at the College of St. Benedict. Since then, I worked about 5 years in quality improvement or performance improvement, did utilization review, worked with insurance companies, supported physicians in their performance improvement activities. After that, I became director for inpatient mental health at St. Cloud Hospital. I did that for 15 years, and a year ago, we split my position and I became the director for outpatient mental health, which has the partial hospitalization programs at St. Cloud Hospital, which includes Clara's House, as well as an adult program at the CentraCare Health Plaza. And then I also supervise the nurses who work in the outpatient clinics, our psychiatry outpatient clinics. I also have completed my master's degree in business administration. I finished that in May of 2011, so I'm a pretty recent grad from that. I'm also certified through the American Nurses Association as a nurse executive, and I've held that certification now for about 6 years. So I've had a pretty wide range of experiences for you to hear about.
Good work. Good evening to the College of St. Benedict and future nurses. My name is Marianne Vertin, and I graduated from CSB's nursing program in 1983. Thank you so much for inviting me here to speak about my fantastic job as a registered nurse on a hematology oncology station at Abbott Northwestern Hospital in Minneapolis. Steve Jobs, in his now famous commencement speech at Stanford, said, "You've got to find what you love." And that is as true for your work as it is for your friends and family. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you'll know when you find it. And like any great relationship, it just keeps getting better and better as the years roll on. So keep looking until you find it. Don't settle. If you care about making your one and only life a life of purpose, of service, of caring, and of being continually surprised by the resiliency of the human spirit, you can build that life in the profession of nursing. There are so many choices within the career itself that you can literally do anything that you can imagine. On my station, most of the people I take care of have cancer, but I also work with HIV, AIDS patients, addicts, prostitutes, alcoholics, and people who might weigh 700 pounds. It's really fun. One learns something new or 10 things new every day. I get to learn new and better techniques for inserting Foley catheters, new chemotherapy drugs, and new ways to eliminate pain completely. I work with massage, with reflexology therapists, and nutritionists, acupuncturists, and chaplains, and doctors. I get to escort dying people to the gates of heaven. You will never be bored. My friend Alice wears a flight suit and ushers people with suspected MIs from the helicopter into ice baths and then into the OR. My friend Dan runs a rapid response team, which is a group of nurses who rush to the side of a person who is on the verge of coding and begin treating them immediately, even before the doctors arrive. Alyssa just got back from a year in Africa working in an AIDS clinic on a ship. And my friend Ann drives all over 3 counties running antibiotics and blood products into people who can't get out to go to the hospital. Going through the nursing program at CSB, I'm sorry, this is going to be a little bit longer, okay? I'm winding down. Going through the nursing program at CSB is a mere shadow of the real thing, but it's a very good start. In your career, you will meet people from every walk of life and from every part of the globe. You will learn how to assist, you could learn how to assist in the life-giving procedure of infusing a patient with their own stem cells in hopes of a full recovery. You could visit the world of the drug addict, hospitalized because he mixed OxyContin with whiskey and injected it into his arm and got an infection. You can care for a superior court judge whose room is wallpapered with photos of Mary and Jesus. You can care for a young woman with pneumonia and 6 personalities. And those experiences are the only ones within my specialty. You could run a hospice, you could start your own home care business, you could work for LifeSource, the organ transplant service, you could bring babies into the world. But one thing is for sure, when you walk to your car at the end of the day, with whatever nursing path you have chosen, you will have the certainty that every single thing that you did just adds and adds to that great ocean of kindness and love and unselfishness, that wave that never ever quite dies out and just keeps going on and on and on through eternity. Thank you for letting me talk about my fantastic job.
I'm Scott Lindell. I graduated from CSB SJU in '91. So you guys should be really excited. You're in a great field, great major. You will really enjoy what you're about to experience and go through with life. When I graduated from St. John's, I went over to St. Cloud Hospital, started working there in a telemetry unit, spent 1 year there, and then moved over to CCU, ICU, to get the critical care experience I needed to get a master's degree in anesthesia. I did that through the Minneapolis School of Anesthesia and became a nurse anesthetist. I've worked now at the St. Cloud Hospital for 14 years, and we've expanded, so we not only provide anesthesia services for the hospital, but we also work at a plastic surgery group in town and a digestive center, and then a outpatient surgery center. There is everything you see in surgery, from a 7-day-old, I think that's the earliest I've taken care of, to over 100-year-old patient. And we do everything from the toe to the head. So you have to be prepared for the full spectrum of ages of patients and everything that could be wrong, with the patient. And again, dealing with patients who are pregnant and having 2 people on an operating table, instead of just the one. So, it's just a very rewarding field. It's you're the one in the operating room when they do the biopsies, and if it's cancer or not cancer. You're there when the traumas come in, and you're there seeing them trying to stop the exsanguination and giving all this blood and products. And I think you guys are old enough maybe when the explosion happened in town. I don't know if you remember that. It was in St. Cloud. We had to shut down the whole operating room to just make sure we had every operating room open for trauma that day. So it's a very, very rewarding field. It's amazing the different types of anesthetics we give and get patients through, and nursing is exciting because you can get a job also anywhere in the world. That's really neat. You can work in the tropics. You can work where it's all snow. Whatever you like to do, you can do it. And it pays well. You can have great families, and you can have money to enjoy the things you do. So it's a wonderful field. And the other thing that's amazing is when you're in this field long enough, you learn that you will be taken care of eventually. A classmate, your neighbor, whoever eventually you just never know who you're going to run into or who you'll be taken care of, and it's very rewarding. So with that, I'll give the mic to.
Hi everyone, my name's Kasy Omann. I graduated from St. Ben's in 2008, and then I started in the new grad residency program at Children's Hospital in Minneapolis. And what the program is, it's for new graduate nurses. It was a 3 or 4 month program where it's tons of continuing education on peds and neonates. I was hired in the neonatal track, so my focus was in the NICU and our step-down units. But I spent a little time on med-surg. I also spent some time in peds ICU, but I mainly was in Minneapolis, St. Paul, NI. And then I was hired into just Minneapolis, NI, where I worked till now, which has been about 4 years. A year and a half ago, I went back to school at St. Scholastica to get my bachelor's it's the Bachelor's to Doctor of Nursing Practice program to become a family nurse practitioner. I'm one of the first students to actually go from the bachelor's to the doctorate program at St. Scholastica, and it's been an amazing experience, and I really like it. I'm actually going to Belize next month for 2 weeks. We're doing nursing down there because they recognize the nurse practitioner degree, so we can actually prescribe. And I went to South Africa when I was at St. Ben's, and it kind of sparked me loving to do nursing abroad, so I've really enjoyed that. And I'll graduate with my FNP in May of 13, so yeah. And now we're going to open it up to questions. Does anybody have any? Don't be shy.
Okay. Well, I guess
I'll read it. Go ahead. So your question is when you enter the working field, how is it related to other jobs? And basically, they're not going to throw you to the wolves. You're dealing with human lives, and usually you'll have 3-month, 6-month orientation. You'll have a mentor. They'll run through what you need to do, what you need to know. They'll go through everything step by step, and you'll be comfortable what you do. No one would put you in a situation where you don't know what you're doing. And if you didn't know, there's a lot of other, staff that you can ask questions and get your answers.
Can I answer that too? Yeah. Scott, with that being said as well, and we were just talking about that over dinner. It's a collaborative effort, and there's always resource folks, and never feel like you're there by yourself. I mean, you always have other nurses that you'll be working with. You're either with a group of nurses or a team. There's resources there for you. Charge nurses, nurse practitioners. You've got a network of multidisciplinary team members that you can go to and discuss things with and throw ideas out and problem solve and that kind of thing. So don't ever feel it's only up to you. You may be the leader or the lead of your team, but now it's more of a team collaborative, is my experience in the nursing field.
Additionally, depending on the organization you may land a job at, many of them have something called nurse residency programs. I know at St. Cloud Hospital we've had that for many years now, and you're actually in it for a year. And so in addition to having that preceptor support, a mentor on the unit, throughout the course of that first year, you get together with other relatively new nurses. You get to talk about what's been going well, what challenges you've had, maybe how they've dealt with it, as well as get some ongoing education about various topics that you tend to encounter that first year that you're working.
I was just going to say that I know for neonatal education you cover it not a ton, but so I started in July with the new grad program. I think it was just a bunch of classes until probably October. And then we started having more preceptorships, like working in the unit, especially in the NICU. And then I wasn't on my own until like November or December. And children's, it's a 2-year program, so they had pullbacks like every 6 months because I started with maybe 20 other girls, and we all became such close friends because it's scary. I mean, it's extremely scary going from school to being at the bedside. But, and more experienced nurses are just an absolutely huge resource, and I still ask tons of questions like this is like, what do you think, what would you do? Don't never be afraid to ask questions. But yeah, so it's kind of 2 years, and from July to December it took me or all of us in the NICU, and that was so.
Well, and I was going to say too, when you're going through your clinicals, you'll probably find a specialty that you'll kind of like and really enjoy. That's why I picked telemetry, because I thought it was really, really interesting how, this guy has chest pain, and the next thing you know, he's coding, and, it was just a real thrill to, to see how these medications immediately gave a response. And just knowing that as a student and watching that was the field that I wanted to get into, and led into all these other things. And that's the neat thing about nursing is when you step into something you like, you never know where it's going to lead you to. Just keep, nursing is always, you're learning all the time, the new advancements in medicines and just techniques and all the things they're doing just keeps you, going and going, and you want to learn more and more. And that's why I think a lot of us, continue to either get a master's or a nurse practitioner, or just continue to LPN to RN to whatever. So that's the neat thing about it.
Did you all find jobs pretty close to
I'm probably the oldest one here, and yes, immediately I was able to find a job. And I know we were just talking at supper about the job market. I certainly can remember back about 3 years ago where the job market was extremely tight and difficult, and a lot of Minnesota nursing graduates were needing to leave the state. That has loosened up. I know for us at St. Cloud Hospital, we have at least a few openings all of the time. So I would anticipate that all of you will be pretty successful in being able to find that first position.
We also are hiring at Abbott Northwestern. When I first started, I think I was part of that time period when nobody had jobs, so I went to Fargo, North Dakota for my first job in neurosurgery ICU. Not a good choice. Pretty scary. So I worked there for a couple years, and then I came down to Abbott and worked in home health care with Abbott for about 6 months, and then got my job that I've now been at for 29 years.
There was, just last week, I worked with a resident. He just starts his new job in August as a family practice doc in a small, over in Morris, Minnesota. And while he was waiting to get into medical school, he became a BSRN. And I know of one other, he's a general surgeon in town, and he was also a BSRN. So it's kind of neat that, you know, it's such a great field because there's so many things you can do and continue to be educated and go as far as you want. And in the meantime, you can make a great living just, you know, I don't want to say just being a nurse, because a nurse is great, just being that. So it's just really, the sky is the limit to what you want to do.
Sounds like most of you guys have done your master's. How is it paying for that stuff? Like your salary, or when you're working, do they help you pay for it?
The question relates to, most of us have master's degrees, and how have we financed that, and do we have any support back where we work? Speaking for my organization, I do have tuition support, so I was able to get some support when I went back. And actually, for me, I went back first for my bachelor's, and at that time I was working within the Veterans Administration system, and they had full tuition reimbursement for me to get my bachelor's, and I suspect that they still have some pretty good tuition reimbursement. And I got it at my organization, and even if my master's doesn't necessarily increase my salary right now, it opens up some more job opportunities for me. Because although I am a nurse and I love nursing, I have moved away from the bedside and really am in the business of healthcare. And so it's important for me to know not only the clinical side, but also the business side of being in healthcare.
Most hospitals, including my hospital, have tuition, tuition reimbursement. I think ours is $2,000 a year, and you can take it year after year after year. You couldn't buy a car, but you could get a pretty darn good education.
We do too, but we have to sign a contract saying that we'll work at Children's for another year. Just otherwise you have to pay back. But yeah, and it's really helpful what they do offer.
You know, through my education, like I said, starting as an LPN, I worked towards my BSN. It took me 9 years to get my BSN, you guys, and that was I got the GI Bill through the military. That kind of gave me the ambition to continue on and to do something with that money. And eventually, and 9 years sounds like a long time, but I'm telling you what, it went like that because I was working full time, and it just becomes part of your life. Now, with your master's program, I'm finishing up with my master's, so I'm not quite done yet. I do work at the VA, and they do offer tuition reimbursement as well. But it doesn't need to, you don't need to say, well, I have to be done in 2 years, or I have to be done in a year and a half. You take it as you can, and I'd say if you work for a facility and they don't have tuition reimbursement, don't let that defer you from continuing your education if that's what you really want to do. Take it slow. Take a class. Take a summer course. Unfortunately, if you have to self-pay, it might take a little bit longer, but don't let that deter you from continuing your education if that's what you want to do.
So the question is, what process did it take us to get to an advanced practice nursing position? In anesthesia school, it's 2 years of critical care experience, and then it was 24 months when I went, but now it's 27 months. It might even be going up to 30 because they're changing it from master's degree programs now to doctorate programs. So it was another 3 years. So you're looking at 5 extra years.
I think the majority of the master's program, obviously first you have to have your BSN before you can get into a master's program. That's probably the first crucial step. And then again, depending on what specialty you're focusing on, they may require some work experience to go along with that. And not always, but like I said, just depending on the area that you want to focus your studies on or your specialty on. Work-related experiences, like an X amount of hours worked in that area.
It seems to me that you might want to think about having some actual nursing experience under your belt before you go on to school. Not everybody believes that, but I really do, because I think you're more effective as you progress, because you know what it's like to be a bedside nurse. Just my opinion.
I did take the GRE too, and then essay writing, sometimes an interview. And then most programs, they offer a variety if you want different tracks, if you want to do part-time, full-time, if you want to get your master's or your doctorate, except now most are turning to straight doctorate programs. So you can do it in 3 years like me, you can do it in 5 years, 6 years, kind of depending on what life throws at you. Because there are a lot of people, I know had major life changes, so they're taking a semester off and restarting back in a year or something like that, and it's kind of go at your pace, yeah.
In the time that I've been a nurse, it has changed. I can't even tell you. It has changed so greatly that if I were to see what I'm doing now, where you are, I'd go, wow. That's really something. I think I can't speak to the issue of men and women in nursing, but I think I can speak to how the technology and the use of the computer has changed nursing radically. Some things better and some things not so good.
I would agree that technology has hugely impacted what we do, even just advances in medicine. Given that I've worked a large percentage of my career in psychiatry, we certainly have seen the changes in the medications that treat mental illnesses, which has greatly impacted how long patients stay in the hospital, being able to get a lot of their care as an outpatient. We were talking tonight at dinner, the acuity of patients that we see on our inpatient units and in our outpatient settings. Some of the general medical surgical floors are seeing patients that we used to see in our younger days in ICUs. I know in my outpatient setting, I'm seeing patients that I used to see only on inpatient units. And so that really does require the nurse that's treating these patients to keep themselves up to date with what's going on in the field, to be able to respond to the things that are happening with their patients when they may not have, when I think of the outpatient setting, all of the resources that you may have on an inpatient unit.
And I also like was because we deal with a lot of HIV patients, and like I've been working with a lot of HIV patients, and my heart just got up. So now that's also another thing that we don't want to do. So I'm still considering which one.
You don't have to choose, you can do them all.
Yeah. But in time, you know. And one other thing, one of my friends wanted to travel the world, but she's doing nursing for she has a patient for. But another reason why she's doing nursing is she wanted to travel boats. On the boat, she's going around the world. So that's why she's doing this.
I just wanted to say that some days are hard, especially when you first start. Like, you do break down, you do get overwhelmed. Even now, I'm like, why am I going back to school? But, I mean, if you want to do it and you love doing it, just continue, because it does get better, and you're going to be experts in helping other students that are new grads.
In some respects, you may be doing the hardest part now. I'm just thinking, because it's primarily grunt work and tests and papers and geez, it just seems like it never ends. But it does, and once you just have to keep your eye on the prize and what's ahead, because it's just so great that every minute that you spent in the library it's going to be worth it. I promise you, it really is.
The passion that got you into nursing, when you are having a rough week, there will be at least one patient or one patient's family that is so grateful for the care that you've provided, and you'll think, it's just what I'm supposed to do, or it's just what I learned in school. But the compassion and caring that you bring to the care that you provide will be returned to you many times over.
We every year our anesthesia company sends people down to Guatemala to, do what's called HELPS missions, and we go to 2 or 3 different locations every year, and it's very rewarding there, because again, what we like about it is it's more like where you're from. We don't have to chart down there. We don't have to get on a computer and check out drugs. We don't have to do anything. All we have to do is administer care. And it's really neat because these patients that we have, they walk for days when they know we're coming. And when the word gets out that we're going to be at a certain location for a certain number of days, these townspeople, gather all their supplies, whatever they can do, and just to come see us. And, it's all free health care. And it's really neat. And one thing that's nice across the board is the anesthetics that we give and the drugs, they work the same throughout the world, Our receptor sites and how we take in these drugs, it's amazing from a little baby to an adult. They hit all the same things. And it's just so rewarding. And so you can be as advanced or as primitive as you want to be, and you're still doing sort of the same things. You're changing people's lives, which is so neat.
Can you talk about your stress level when you're first starting out until now in terms of physically lifting people or just getting in place?
That's a good question. That's a very good question. When I first started in my stint in neurosurgery, I was scared to death. But the longer you're in it and the more adept you become with your skill set, and the more you polish them and the more greased up you get that Foley catheter, the better it becomes, because then you get to a point eventually where you can relax. You almost can relax because you have your skills down so well and you know them so well that you're worried about the patient and not if you're going to screw up the sterile field. The stress, there is a lot of stress, but I think that you need to really take care of yourself. And as nursing, primarily has been historically a woman's profession, and we don't really take care of ourselves because we take care of everybody else. But you need to take care of yourself. You need to make that a priority. You need to always ask questions, and you need to be authentic and have fun.
And I think it's okay not to have all the answers, when you're stressed out and you being the RN and you being the charge or the lead role, and people come to you to expect you got to know what you're doing because you're the RN. It's okay not to have all the answers all the time, and that can be stressful. Use your resources, use your coworkers, use your charge people. Like I said, network together, because that's going to be your biggest aid, I think. Don't feel like you have to do it alone. And sometimes that'll just come as you get more comfortable and whatnot. But and talk about it. Don't hold it in. And if something's bothering you, if you had a really bad day, or if you just your patient's crumped, or whatever the situation is, it's good to talk about it, because then you take that home and you think about it, you dwell on it, and in the next couple of days you're working a 12-hour shift, and it doesn't get any better. I mean, you're still holding that stress level. And like Marianne said, you need to take care of yourself. And whatever that is, if it's exercise or yoga or going for walks, make time for yourself and just communicate that.
After that, do you often go home and about
The question was, if you had a bad day, do you go home and continue to think about that? There are days earlier when I used to work at the St. Cloud Hospital, when I first started nursing as well, and and it's like I said, patients are sicker, acuity is higher, and there were days, honestly, you guys, I went home and I felt there was no way, if I was a patient, that I would have wanted me as a nurse. That's how bad I felt, because I did not spend it. I just felt that I should have spent more time with my patients, but the workload just wouldn't allow it. But honestly, you beat yourselves up. You do the best you can. You give high quality, safe patient care. You ask for help if you need help. But yes, absolutely. And you have to let that go. You do the best that you can. And then, like I said, try to just work through that stress. And of course, we all want to be the best we can be and be the greatest nurse we can be and be there for each and every one of our patients. But some days, you know, you get the bare minimum, and that's the best for that day.
I just recently found out I wasn't a god. And this is important because sometimes in our profession, like you said, we think we can heal everybody, we can fix everything, we can make everybody happy, we can make sure nobody has pain. But the sooner you realize that you're never going to be able to do that as much as you want, the better off you're going to be, because you're only human, you're not gods, and you have limits, and you can only do the best you can do. But if at the end of the day you can say, I did the best I could do, then that's it. You're going to go straight to heaven.
Just the other day, we did a procedure that was called an aneurysm clipping. And I had never done one in school. You know, may have read about one, 15 years ago. But it was a new procedure. And I said to the nurse in the room, I've never done one. And she said, don't worry. The surgeon will meet with everyone in the room. We're going to have a huddle. He's going to go through all the things that we need to do. And go from there. And that's exactly what he did. He came in early. It was about hour before the case. He was there, and he said, all right, does everybody know what we're going to do? And, nope. And he said, all right, we're doing this, this, and that. We need to order from pharmacy, this, and that. And we had all these blood products lined up, this, and that. And, basically we had everything we needed. And the nursing staff had everything that he had wanted, and they hadn't worked with a lot of the instruments. The surgical techs were unfamiliar with the stuff, but they knew, what he wanted and had available. And so I always say you kind of just take baby steps. You just take it, a heartbeat at a time, and just keep, we always used to say in ICU, if they had a heart rate and a blood pressure, you were A-okay. Pulse and a pressure. And, so that stays with you. And those are the fun, exciting things you find yourself into, not every day, but certain days. You never know what you're going to wake up to or get yourself into. And you go home at the end of the day and think, wow, that was really amazing. And the other thing that's neat now that wasn't there 10 years ago was that technology aspect. We have so many TVs and cameras in the operating rooms where you can visually see everything the surgeon's doing now. Whereas before, when I started in practice, you could see them, cutting the head open, but you didn't know really where they were at, or if the brain was herniating or starting to bleed more. You weren't really aware of that until the surgeon started yelling at you. So, now we can actually see what we're doing and have that benefit of just seeing everything. And that's for all the specialties, general surgery, urology. It's really advanced, and it helps us, it helps them, it helps everyone in the room. And we were talking at dinner, too, about the collaborativeness of everything. And we always say in anesthesia, we're only as good as the weakest link. So if there's a weak link, it needs to be notified and changed, because everyone is affected by the whole system. And so, yeah, you're never alone. There's always a lot of good resources out there, and even the doctors, they're not going to tackle things that can't be done. They know their limits too, and because they're on the line too, and they're looking out for the best of the patients too. So they want good outcomes, and you do too.
Well, when I'm interviewing people, I tend to look for them to tell me about how they've done things. So rather than, I don't want to hear about what the book says you need to do or how you might respond. I tend to ask questions that has to do with, give me an example, describe for me an encounter you've had with a patient, tell me how you've helped your team members do a better job at what they're doing. So I'm really looking for examples about how you've actually done the work versus telling me what a teacher might have told you.
And I would say just don't give up. Be confident, and if the first interview doesn't go as well as you want to, just use it as a learning experience and go through it again with someone else. And I always like to say the best thing about interviews is the follow-up. You know, you're taking their time away, so when you're done, don't just think, well, I hope I got the job. I wonder if I got the job. You know, send them a letter of thank you, a follow-up. You know, continue to show that you're interested even after the interview, to say, you know, where are we at? I haven't heard for a while. You know, thanks again for your time. Whatever. Just be persistent and just grateful.
My sister actually used to work for the Career Resource Center with Mary, and she gave me a list of questions, just basic questions that are usually asked, and I would keep going through like how I would respond, and I had specific patient scenarios that I would kind of have in the back of my head that I could apply to different questions, and that's kind of what I did with my interviews. I kind of tried to go off what I practiced and repeat it over to myself, or I practiced with my sister too, so that was kind of helpful.
One interview from the next interview can be extremely different too. You never know different people's personalities, and you may think that you are not cut out for it because of that bad interview, and just keep believing in yourself, because you're probably wrong. You are, if you're interested in it, you'll be able to do it.
Is studying abroad or having a minor something employers look for, or what's something to add to
I was just going to say that for almost all of my essays and my interviews, because I studied abroad in South Africa, I talked a lot about that, and I really think it was something that made me stand out from other students, because a lot of us, we all get good grades, we all, do extremely well. We're here, but I do feel, well, for me, I feel like it did help me, just having certain things certain experiences that I had when I was in South Africa did help.
Certainly can't hurt.
Or even if you volunteer or something, or, just getting involved besides book learning, I think gives you just more experience. Or yeah, it does in what you see and how you have to adapt to different situations and not having the resources and the tools that we're used to here. And and it's just such heartfelt stories and just how I felt while I was there, and that's why I'm going to Belize. And Children's actually, they're taking a group of NICU workers and we're going to India for a month, and I really want to do that too, because they're starting a children's hospital there. But it just opens your eyes, and it really makes you thankful for what we do have here and how much more care we can give to our patients.
I would add, though, since not all of us can study abroad, that another good example would be a volunteer experience, even if, to do something through Salvation Army or Place of Hope here in St. Cloud. So again, you are getting that experience outside of just the book learning.
Well, there's a lot of groups that you can go with too, like do medical missions, but for some reason on my unit, they also go to Guatemala every year to teach at some hospitals, like different neonatal resuscitation steps and different things like that. And now this going to India. But the whole hospital itself, I mean, they do work with different companies like Pro World to help do medical mission trips, but I'm not sure at other hospitals, I guess.
Is that funded through the hospital, or do you have to pay part of that on your own?
This one, actually, that they're doing, that's going to India, that you get your same pay and you get your same benefits while you're there for a month. You just have to pay for your plane ticket. And then the one to Guatemala that they do every year, it's nurses that actually support that. And that is, they do pay, you pay for yourself. But when you go in a group, expenses are cut down a lot.
Yeah, that's the same in our group. It's you pay out of pocket, but it's at a reduced rate.
Do you feel like your clinical experiences prepared you for your first job? Because, I mean, you said like you had 3 or 6 months or whatever training before, but some of the basic general skills, do you feel like you had enough practice?
The question is, do you feel like you had enough practice when you went to your first job? I know I did. I really felt like school had given me a good basic foundation to build from. Probably the biggest change is you go from having 2 patients, 1 or 2 patients when you do your clinicals, to probably having 6. So it becomes a little bit more of a challenge to spread yourself out. But I really did feel like I had the knowledge behind me and even the clinical experience to pull from, and then to use my resources in the setting, because at least where I've worked, no one expects you to do it all on your own. And so you do have those resources that you can go to.
Excuse me, I agree. The clinicals at the college, especially the St. Ben's program, did a great job when I was in school of preparing us in our clinical sites. And it was nice that we had a variety, because it kind of gave you, you do a pediatric rotation. Well, pediatric just isn't my thing. And then all of a sudden you'd go to medical oncology unit and say, wow, I really love this, or mental health. You kind of got an area where you liked it more than others, and then you probably, let's say if you liked, mental health a little bit better than the pediatric rotation, you might have asked a few more questions or did a little more research on it and that kind of thing. So you pick up, and I think you grow from the areas that you want to potentially focus on after graduation. So I think the programs do a great job in preparing what's expected of the new grad in your clinical rotations.
I don't feel that my experience in the nursing program way back when was very much like it is now. I think it was a great deal different. I remember one bed and one Resusci Annie that had had everything done to her that she could possibly have done. So it was pretty rudimentary back when I first started practice, but I didn't feel that my schooling prepared me for my job, but it didn't matter, because there's so much of the job that you learn on the job in a supportive network of your coworkers, and that's really where you learn the most stuff. I think maybe you get a basic understanding of maybe like where a urethra is, but most of the learning, I think, don't you agree, occurs on the jobs?
Yeah, I just felt like I walked in with a good knowledge base to start with, to do that learning on the job.
Yeah.
What would it be end with maybe some tips that all of you would have for career nursing students and those that are graduating? Maybe as a teacher and
I'll start on this end. Or I said I'll finish on this end. I would just, again, you guys, take advantage of whatever opportunity comes along, because you know what, you just, you may start a job and just think, you know what, oh, this just isn't quite my thing. Another job offer may come up and you're thinking, oh, you know what, I'm not sure about this. But if at all an interest sparks, take advantage of opportunity, because in the career of nursing, it's unlimited. It really is unlimited.
Yeah, my advice would be similar. Whatever it is you like doing within nursing, head that direction. So whether it's being a med-surg nurse, whether it's being a hospice nurse, whether it's doing medical oncology, whatever it is that you really have a passion for doing, that's where I would start.
Using both. I would say, again, you really need to pay attention to taking care of yourself. Second thing would be, don't worry. I know it sounds really trite, but you're doing the hard part now. It's pretty stressful being in nursing school. I was a nutcase. Our whole class was. We were talking at dinner about how the makeup of nursing classes have changed, and one of your professors talked about how collaborative it was, and you worked in groups. And I remember thinking we were so incredibly competitive, and we would argue for a point or a half a point. Do you do that? See, so some things haven't really changed, but this is the hard part, and once you get into the field and you start picking up steam, it's kind of like, when you first start working out, some people work out. When you first start working out, you just got to make yourself do it, but then the more you do it, the better it feels, and you become really confident, and then there you go. Then you have fun, but don't worry, because it really will be okay. It really will.
Yeah, I would just say take a day at a time. Look into the future, but just get through this day. Get through this studying tonight, wake up in the morning. Just keep plugging away. You'll get to the end, and you'll be tired, and you won't believe you got there, but then you'll be like, oh, maybe I should do more. And like you said, it's just do what you can handle and take time for yourself and enjoy it along the way. Try to enjoy every aspect of every day, at least a part of it, and you get there.
I was just going to say that you're not going to know what you don't know. Like, regardless on how much you study, how much you prep, you're going to have situations where, you don't know the answer, you've never seen it before, and just learn from it. Take a breath, learn from it, and we all have that moment, but now you'll know, and now you'll remember.